Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Antimuscarinic drugs. Antimuscarinic drugs are present in two generations, first generation and second generation. First, we have first generation. Examples of first generation are trepenelamine, pheniramine, CPM, cyclazine, meclazine, cyproheptadine, trazodone, hydroxyzine, and we have promethazine. So first generation are tripelenamine, pheniramine, CPM, cyclazine, meclazine, cyproheptadine, trazodone, hydroxyzine, promethazine. Then second generation H2 blockers are, we have terfenadine, astimazole, citrazine, levocitrazine, then fexofenadine, azalastine, then loratadine, desloratadine, and also mesalastine. So second generation are terfenadine, astimazole, citrazine, levocitrazine, azilastine, mesalastine, loratadine, desloratadine, and fexofenadine.
thank you and thank you for watching.